Raise your hand if you have health insurance. Good. Everyone in this class should have his or her hand up, because if you did not have your hand up, you could not attend this college. Raise your hand if you have a home. Again, all hands are raised. We in this class are lucky to not be included in the 3.5 million Americans who experience homelessness each year. Among those 3.5 million Americans, many lack what we take for granted: healthcare and access to mental health care. Today I will be informing you on how the lack of mental health care caused by low income leads to higher uses of emergency departments rather than primary care physicians, higher substance abuse rates, and most concerning, increased rates of serious mental illness. To begin, the rate of homeless people entering emergency departments seeking medical care trumps the rate of homeless people using primary care physicians. The cost of seeing a primary care physician is just too much for someone who doesn't know where their next meal is coming from. According to the case study of Psychiatry and Clinical Neurosciences performed by Dr. Nishio in 2015, which focused on a group of 18 homeless subjects, out of the 18 subjects studied, 14 of the participants obtained cash income by collecting and selling empty cans, while the other 4 had no means of obtaining cash income. The cost of a primary care physician is too great for people who lack significant funds to pay for health care. I work in a retirement home, and I have been exposed to residents who do suffer from mental illness. However, the people I work for have the means to be properly treated. In the case of the homeless, they are forced to fend on their own, which in the minds of the homeless, food and shelter is more important than health care. According to Dr. Tsai in his article, When Health Insurance is Not a Factor, National Comparison of Homeless and Non-Homeless U.S. Veterans Who Use Veterans Affairs Emergency Departments, published in the American Journal of Public Health, other studies have shown homeless patients who use emergency departments often have no other source of health care. This lack of health care corresponds to the deteriorating mental health of homelessness due to the lack of access to proper care and treatment for disorders. The increase in mental illness is attributed to the avoidance of primary care physicians. According to Dr. Swastik, in his study featured in the article Impact of Health Insurance Status and a Diagnostic of Serious Mental Illness on Whether Chronically Homeless Individuals Engage in Primary Care, published in the journal, the American Journal of Public Health, neither a diagnosis of serious mental illness, schizophrenia, or bipolar disorder, nor any measure of psychiatric symptom severity was significantly associated with having a primary care physician in this step. Second, I will discuss how the lack of exposure to mental health care increases the use of drugs and alcohol in the homeless population. A substance abuse disorder is classified by the DSM-5, written by the American Psychiatric Association, as the essential feature of a substance use disorder is a cluster of cognitive, behavioral, and physiological symptoms indicating that the individual continues using the substance despite the significant substance-related problems. Thus, the tolerance is built up, and the continued use of a drug or alcohol is pursued by the user. The increased amount of health care would benefit a drug user by ensuring that a rehabilitation center would possibly be able to help and treatment could begin. In a study of 750 chronically homeless adults, according to the previous cited study performed by Dr. Chostik, more than half of the participants reported use of a drug. This drug use increased the amount of time spent in emergency departments, which increases the amount spent being homeless. As a side note, drugs do not cause someone to be homeless, but using of drugs while being homeless can increase the amount of time spent being homeless and in and out of healthcare. A third disadvantage of the homeless populations indoors due to the insignificant healthcare is an increased rate of serious mental illness. Serious mental illness is usually considered to be schizophrenia, bipolar disorders, or depressive disorders. The previously cited DSM-5 classifies schizophrenia as a combination of delusions, which are thoughts, fixed beliefs that are usually disorganized, and hallucinations, which are perception-like experiences that occur without external stimulus. Bipolar disorders are uncontrollable shifts in manic and depressive stages, which is happy and sad stages. Depressive disorders are different than bipolar disorders due to the lack of the happy phase, or the manic phase. According to Dr. Lisage in his article, Consensus Statement on Improving Mental Health Care Transitions in the Canadian Journal of Psychiatry, prevalence of mental illness is higher among homeless people compared to community control. This data corresponds to the data found by the Child Welfare Study by Dr. Mershon in 2009, in which 182 homeless youth in Colorado were tested on their mental health. This study reveals levels of mental illness among homeless youth with severe and persistent mental illnesses such as schizophrenia, bipolar mood disorder, depression, and PTSD. The inability for teenagers to afford health insurance continues the trend of injustice towards the homeless population. According to the aforementioned study by Dr. Mershon, the data strongly suggests there is a high incidence of mental illness, substance abuse, trauma, and suicidal ideation that would be expected in most teenagers. So being homeless increases the amount of mental illness suffered due to lack of health care. In conclusion, today I have taught you the conditions of the homeless population's mental health is suffering, resulting in higher homeless uses of emergency departments, higher rates of substance abuse, and higher rates of serious mental illness. Although some efforts are being made in improving the mental status of the homeless, the increased numbers of serious mental illnesses has become a great concern among preserving the health of the homeless. Stop.